The food we eat is processed into three major parts: carbohydrates, fat, and protein. These parts are used as a source of energy, and what is not required is stored inside the body, mostly as fat. The ratio of what is used to what is stored is a complicated process, the basic factor being the input, diet, to output, exercise. Most fat is deposited deep inside the body and can only be reduced by proper diet and exercise. To a lesser extent, fat is deposited under the skin. This fat is 2 parts deep and superficial. This fat can be reduced by using a process called liposuction.
Hello, I'm Dr. Kenny Levine. Welcome back to Health Talk, WYW19.com, Uverse Channel 19, and Comcast Channel 87, south of where we are. I'm here with Dr. Jason Altman. Jason, we're talking about breast implants. In my practice, I see a lot of infants, newborns, who refer to me for laser tongue tie releases because they're having difficulty nursing. And the moms come in and they're very frustrated. They get beat up by the baby. They're sore and bleeding and very uncomfortable. And by releasing the tongue, we can make it a much more comfortable procedure for the mom and beneficial for the baby. Question that I would have is, after you do an augmentation on a breast, does it still function?
It's a great question, and it's a question most of my patients ask me. A lot of the younger patients sort of forget or don't think about the breast as a functioning organ, but it is.
Right.
And we aim to preserve that with our operations. The majority of breast implants that I place, and I think that most surgeons place at this time, are referred to as behind the muscle. And what that means is the pectoralis, or the pec muscle, is actually elevated up off the chest wall, and the implant is placed behind that. So the breast gland, the ducts, and the course to the nipple are all still intact and functional.
They're exterior to the implant.
Exactly. So most women, it's very difficult to say that all women who get breast implants will be able to breastfeed, because many women that don't have breast implants can't breastfeed.
Right.
But the implant itself should not impact their ability to do so, nor should the implant cause any problems with the milk or milk production.
Do you need to reposition the nipple?
Position of the nipple depends on what they looked like before the surgery. Women that have breastfed prior to getting their implants, or that have lost significant amount of weight, may need some sort of lift of the breast at the same time as the placement of the nipple, the placement of the implant, to get that nipple back into the center of the breast and centered on the implant.
Let's talk about liposuction.
Great.
All right. Now, liposuction, people think of it around the belly. Can it be done on the face?
Absolutely. It can be done below the jaw. So liposuction of the neck is one of the most common operations we do with liposuction. It's great in men and women, especially those that are starting to see the signs of aging but are not ready for a bigger operation, such as a facelift or a neck lift. That liposuction can really be used to define their jawline and give them a more youthful neckline. And then heading down the body, we do liposuction on the arms. We do it on the chest of men, something called gynecomastia, where men have hypertrophy or overgrowth of the breast tissue. That can be treated with it. We do it in the belly, we do it on the thighs, and one of the most common things we're doing today is using that fat that we take out from certain places and injecting it back into other places. We can use it to fill out the face in the same way you would use the artificial fillers, the hyaluronic acid such as Juvederm and Restylane. Fat can be permanent, which is a benefit over the commercial fillers.
Right.
It's a little more technique dependent, requires a little bit more skill, and the fat has to be handled and treated properly to get it to live. But its long-term effects are beautiful, and it's using your own body's natural tissue, which is great.
Well, you brought up something that I wanted to touch on with you. A lot of my friends have had Botox.
Yep.
Okay? And as a surgeon, as a periodontist, I want to do a procedure and not have to do something for my patient. They're going to have to come back 6-9 months or a year later and have it redone. That's not the situation with Botox or things like that, right?
Correct. Those are temporary solutions. I tell people to think of them as sort of a commitment. Think of it as you would coloring your hair or other sort of ritualistic grooming procedures that you go through. They all have their place. Botox is used to relax active muscle lines, so the lines you get in the middle of the forehead, those crow's feet here. Right. And it works very well in combination with other procedures as well. I'm starting to do it on younger and younger patients as we see the benefits of using it almost preventatively before the deeper, more permanent lines form. If you can get them to use it habitually, it'll relax those muscles and those lines and prevent some of those wrinkles from forming.
Interesting. So you can do some preventive care with the Botox.
Absolutely.
To stop it from getting worse. We're going to continue with this in just a moment. It's Dr. Kenneth Levine with Health Talk. We'll see you in just a minute. Thank you.